My name is Nabila Shakira binti Razak.
Assalamualaikum, my name is Nur Johera binti Muhammad Zaid. We want to
Present our
Ptm project about autism. Introduction. Autism is a syndrome that affects children's brain function in terms of cognitive, behavioral, motor cycle, and fine motor skills, language and communication, as well as social and emotional.
According to the American Psychiatric Association, autistic disorders are when they involve a significant disorder or problem in an individual's development to communicate, social skills, and interact with her environment, which has limited her activities and interests. This autistic problem can be identified before the first 3 years, but where a child with this problem will present problems and face disabilities, develop social relationships, and think creatively. Studies show that 1 in 166 children in the world have autism, but the causes have not been well identified. One theory states that the syndrome is caused by genetic factors and that the problem may also be environmental factors including televisions. Viral infection caused by a mother during pregnancy also contribute to the cause of a child with autism. Infection of virus such as rubella, tozo, herpes, malnutrition, food poisoning can affect brain cell growth and, in turn, interfere with the functioning of the baby's brain. This causes the communication, understanding, and interact aspect to be interrupted. Background of study. First, autism is developmental. Is disorder characterized by difficulties with social interaction and communication, and by restrict and repetitive behaviors. Parents usually notice signs during the first 3 years of their child's life. These signs often develop gradually, thus some children with autism reach their developmental milestones and at a normal pace before worsening. Second, every couple who sets up a home certainly wants the light of life to shine through. Having healthy, fit, and smart kids is the dream of every parent. However, the tests and challenges must be met by a couple who are aware special needs children such as autism. This can put pressure on parents who have special needs children and who have developmental problems and other developmental problems. Third, referring to Sumrah, Sudirman, and Ahmad, in his study state that behavior problems in children needs to be taken seriously by all parties and the role of parent is very important in this regard. The responsibility of parents is very important in the education of children from birth to adulthood. Patience with parent and family members is important in providing the best care possible people with autism. Parents also do not have to give up and always take good care of their children. Lastly, treatment and education can bring about positive change in attitude, competence, speech, and self-reliance. In this regard, an app will be developed for autistic children through a home-based learning approach. This visual aid application is to help parents provide at home.
1. Discuss the problems parents face in autistic children. 2. Assist parents in providing continuing education through approach home study. 3. Develop application software suitable for autistic children.
Autism is a disability. For right now, there is no special medicine or treatment that would make it go away. No one can teach it from being near you. People with an autism spectrum disorder usually live a normal lifespan. There are 3 types of autism spectrum disorders. Autistic disorder, this is sometimes called classic autism. Asperger's syndrome. People with Asperger's syndrome usually have milder symptoms of autistic disorder. Progressive development disorder not otherwise specified.
Not only teachers but also parents play a role in providing education for autistic children at home. Therefore, these children need special learning for the care at home. First, it requires students to learn how to apply knowledge to solve problems. Second, make decisions. Third, identify and assess the validity of the assumption, conclusion, and hypothesis. For example, theoretical reasoning, concept attainment, concept formation, inquiry training, and open-ended discussion. Visual communication interactive CD for children with autism. This interactive CD focuses on learning using a variety of activities. There are 4. The main menu is memory, shape machine, picture machine, and puzzle. Memory activity is given to them to remember a picture and grasp it correctly. Lastly, Prevalent Interactive CD. Prevalent is an interactive multimedia therapy application specialized designed for autistic children. There are 2 categories, beginner and advanced categories. This category is selected based on the level of ability of autistic children. Each category has activities such as picture machine and color rendering according to their difficulty level. The app also provides music space as a therapy to entertain them while playing. Meanwhile, the design of the application is soft, easy to navigate with colors.
Drawbacks. People with autism will tend to just play gadgets. There is no stimulus for conversation between adults and children. Technology interactively cannot replace human interaction because the latest technology cannot replace the human element in the interaction between parent and child. Potential to interrupt sleep. Children need at least 12 hours of sleep daily for them to grow up healthy.
Conclusion. This multimedia application is expected to help autistic children, especially 6 to 12 years old, in the process of learning and development. The app is to achieve the objective of presenting simple, entertaining, and conceptual interface with real-world mental model. In this hope that the use of this approach will provide an update on the teaching and learning concept of autistic children. In terms of delivery, this application benefits the autistic child by applying the psychology of the child to how media elements affect the development of autistic children's learning. In addition, the learning modules to be provided are in the basic and daily routine of autistic children. The application will be developed in a format suitable for autistic children in the project file format, and the mobile application uses a flash player to support the application. This app will help parents provide early childhood education through a home-based learning approach. For future distribution, the project will be CD-ROM. This type of distribution is faster, cheaper, and easier for the distribution process.